move before removing needle from a puncture site. Tourniquet. Syringe order of draw: yellow, blue, green, lavender, gray and red. Yellow tubes are used for blood culture. Blue. Green tubes are heparin. Gray tubes are oxalate fluoride. Red tubes are non-additive clot tubes. Blood culture tubes topper are yellow. Citrate tubes topper are light blue. Non-additive tubes are red. Heparin tube toppers are green. Hematology tube toppers are lavender. Gel separator tube with heparin tubes toppers are green-gray. Glucose tube toppers gray. Invert tube 8 to 10 times. PST. Plasma separator tubes. BMP. Basic metabolic panel. ETO. Ethyl alcohol. FSH. Follicle stimulating hormone. PSA. Prostate-specific antigen. RPR. Rapid plasma region. ACD. Acid dextrocitrate. SPS. Polynethosulfonate. Sodium citrate is for what topper and in what order of draw? Light blue, second. Found third in order of draw for vacuum tube or last in syringe. The topper color is red. Titers, RPR, blood bank type and cross-match are collected in what color and additive? Red, none or glass particles. Serum determinations panels are collected in what combination color tube and what is additive abbreviation? Tiger and with SST. FSH and PSA testing are collected in what color tube? Tiger. Prothrombin time coumadin therapy, partial thromboplastin time heparin therapy are collected in what color tube and with what additive? Light blue with sodium citrate. Electrolytes and platelet counts are collected in what color tube? Green. CBC, WBC and differentials are collected in what tubes with what additive abbreviation added? Lavender, EDTA. EDTA. Ethlenidium and tragedy C. Lavender with EDTA are used for hematocrits, glycohemoglobins, hemoglobins and sedimentation rates. Tube used for DNA and paternity testing and with what additive abbrev? Yellow, SPS. Tube used for viral loads and with what additive abbrev? Yellow, ACD. Basophil. Granulocytic white blood cell with dark purple cytoplasmic granules. It is the least common of the white blood cells. CBC. Battery of hematologic tests consisting of hemoglobin, hematocrit, total white blood cell and red blood cell counts, differential white blood cell count and the erythrocyte indices. Eosinophil. Granulocytic white blood cell with red eosin stain granules in cytoplasm. It is elevated in cases of allergies. Erythrocyte. Red blood cell, one of the formed elements of the blood. Erythrocyte sedimentation rate. Measurement of how far the red cells in a sample of blood decrease in 1 hour. Erythropoietin. Hormone that causes production of new red blood cells. Hematocrit. Percentage of red blood cells within a specimen of anticoagulated whole blood. Hemoglobin. molecule with a red blood cell that transports oxygen. Hematology, study of blood and the blood-forming tissues. Hematopoiesis, formation of blood cells. Leukocyte, white blood cell, one of the formed elements of blood. Monocyte, white blood cell without cytoplasmic granules that has a large convoluted non-segmented nucleus. Neutrophil, the most common type of granulocytic white blood cell. Thrombocyte, cellular fragment of megakaryocyte, plays an important role in blood coagulation, hemostasis, and clot formation. Lymphocyte, white blood cell with a dense non-segmented nucleus and lacking granules in the cytoplasm. Erythrocytes, another name for red blood cells. Leukocytes, another name for white blood cells. Thrombocytes, another name for platelets. Study of normal and diseased cells. Hematology. Bone marrow, primary site after birth at the production of erythrocytes, granulocytes, and platelets. Lymphocytes are produced where? Bone marrow and lymph nodes. Red marrow. Bone marrow that is producing cells is known as blank. Yellow marrow. Red bone marrow is replaced by age 20 except for in the ribs, vertebrae, sternum and iliac crest by what? Another name for stored fat. Yellow marrow. Liver, spleen and yolk sac. An embryo has hematopoiesis occurring where? Hematologic tests. Second most common tests performed in the physician's office. UA. Most common test performed in the physician's office. POL. Physician's office laboratory. UA. Urinalysis. Complete blood count. Most ordered lab test on blood in the ambulatory care setting. CBC includes hemoglobin determination, hematocrit determination, RBC count, WBC count, erythrocyte indices, differential WBC count. Moderate to high complexity and not under the scope of MA. Manual blood cell counts are considered by CLIA. Hemoglobin and hematocrit. Part of CBC but also frequently individually ordered by a physician. HCT. Hematocrit. HGB. Hemoglobin. Moderate complexity and not under the scope of MA. Automated blood cell counts are considered by CLIA. Hemoglobin. Major component of the red blood cell. Serves to transport oxygen and carbon dioxide. Hemoglobin. Protein, heme and globin. About 85% of the dry weight of the RBC and is a conjugated blank of what? 1/3. Normal HGB is about this compared to HCT. Iron. Synthesis of the heme molecule requires 95%. HGB carries about how much of oxygen to the body? 27%. Hemoglobin carries about how much carbon dioxide away? Bright red. Oxygenated hemoglobin. Darker red. Unbound to oxygen hemoglobin. Arterial blood is what color? Bright red. Venous blood is what color? Darker red. Venous blood. Blood traveling back to the lungs. Arterial blood. Blood coming from the lungs and to the cells. Another name for the oxygenated hemoglobin. Arterial blood. Hemoglobin without an oxygen bond is called venous blood. Telephone. Hemoglobin helps maintain this. The second function of hemoglobin is Blood buffer maintains the proper balance of telephone. Balance of oxygen and carbon dioxide. Proper pH balance by hemoglobin is done by picking and dropping off what? Erythropoietin, a hormone that triggers production of RBC. What hormone does a low oxygen level trigger? Erythropoietin. Anemia, the most frequent hemoglobin disease seen in the ambulatory care setting. Iron deficiency, the most common type of anemia. Hemorrhagic anemia, losing iron because of a bleeding problem. Aplastic anemia, congenital defects or industrial toxin or bone marrow disease might cause this hemoglobin disease. Oxygen, symptom of fatigue in anemia is caused by a lack of packed RBC volume. Hematocrit. Hematocrit, the volume of RBCs to that of the whole blood specimen. A few drops. How much blood is needed for a hematocrit? EDTA, ethylene and triglyceric acid. Centrifugation, what separates a blood sample into layers? RBCs. Bottom layer after centrifugation. Most numerous of blood sample and heaviest. RBCs. WBCs and platelets. What is in the Buffy coat? Whitish tan. Color of Buffy coat. On top of erythrocytes. Where is Buffy coat impact cell column? Buffy coat thickness. How is WBC count given an estimated measurement? Red blood cells. What type of cells remain within the blood vessels? Travel into tissues to find and destroy pathogens. Why do WBCs leave blood vessels and where do they go? Pus occurs. Bacterial battlefield is too large for body to absorb, so what forms? What dies in the bacterial battlefield? WBCs. 3 to 5%. Normal value for neutrophil bands. 54 to 62%. Normal value for neutrophil sags. 25 to 33%. Normal value for lymphocytes. 3 to 7%. Normal value for monocytes. 1 to 3%. Normal value for eosinophils. 0 to 1%. Normal value for basophils. Neutrophil bands. Type of leukocyte increase in appendicitis. Lymphocyte value. Type of leukocyte increase with mononucleosis, lymphocytic leukemia. Monocytes value. Type of leukocyte increase in tuberculosis. Eosinophils value. Type of leukocyte increase with allergic reactions, hay fever and parasitic infections. Basophils value. Type of leukocyte increase with polycythemia vera, chickenpox and ulcerative colitis. Lymphocyte returns to bloodstream. When leukocytes travel into the tissues, they usually remain. Only one type doesn't. Name it and where it returns. Granulocytes and agranulocytes. Name the two basic groups of leukocytes. Staining process. How are the presence of lack of granules visualized? Neutrophils, basophils, eosinophils. Name the granulocytes. Lymphocytes and monocytes. Name the agranulocytes. Phagocytosis. An engulfing process performed by all leukocytes. Neutrophils and monocytes. Name the leukocytes that specialize in phagocytosis. Phagocytosis protection. If leukocytes lost this protection process, we would die. early or younger forms of neutrophils. Along with an increase in these with acute appendicitis, you will also find what form? Lacking or low in color, hemoglobin. With anemia, the person's erythrocytes will appear this color and red blood cells will show less blank content. Immunity. When a repeat intruder is recognized by the body and it is better able to defend itself. Lymphocyte, which destroy the substance. When harmful substance enters the body and immune response is provided by what and does what. Passive immunities. Usually do not make us sick but do not last longer than 6 months. Composition, function, and in numbers. How do erythrocytes differ from WBC? Oxygen. Erythrocytes are responsible for carrying what to the body's cells? Carbon dioxide. RBC are responsible for bringing back what from the body's cell? Normocytic. RBC of normal size. Macrocytic. RBC of larger size. Anisocytosis. Erythrocytes with marked variation in size. Irregular and varied shape. WBC shape is. Biconcave. RBC shape is. Normochromic. RBCs with the proper amount of hemoglobin filling about half the cell is called. Hypochromic. RBCs without the proper amount of hemoglobin. Platelets. Another name for thrombocytes. Platelets. Name both terms for a normal number value of 140,000 to 400,000. Cytoplasm. Thrombocytes are actually fragments of. Coagulation. Thrombocytes are involved in the clotting of blood called. Chemicals, thromboplastin. When body is physically injured, what is released and name one released from tissue? Fibrinogen into fibrin. Thrombin chemical converts what blood protein into what? Fibrin. Stringy and traps the sticky blood cells in a web at the site of an injury. Plug. Fibrin forms a blank of sorts. Scab. The plug at a wound will shrink and dry up and eventually become a antithrombin. Released by the liver so the body does not form blood clots inside the blood vessel. Heparin. Released by basophils and endothelial cells so the body does not form blood clots inside the blood vessels. It happens at the site of injury but not normally clot inside the blood vessels. What is fascinating about the clotting of blood? Bleeding. The body needs blood to clot to stop. Indices. Like indexing. Accreditation. Process whereby recognition is granted to an educational program for maintaining standards that qualify its graduates for professional practice to provide with credentials. Ambulatory care setting. Healthcare environment where services are provided on an outpatient basis. Ambulatory is from the Latin and means capable of walking. Examples of ambulatory care settings. Solo provider's office, the group practice, the urgent care center, and the health maintenance organization. Attribute. Inherent characteristic. Bachelor's degree. 4-year academic degree conferred by colleges and universities. Certification. Guarantees as being true or as represented by or as meeting a standard. Certified medical assistant. A certified medical assistant who has successfully completed the ALMA's National Certification Examination. Competency. legally qualified or adequate. Compliance, conformity in fulfilling official requirements. Credentialed, testimonials showing that a person is entitled to credit or has a right to exercise official power. Dexterity, skill and ease in using the hands. Diploma, a document bearing record of graduation from or of a degree conferred by an educational institution. Disposition, temperament, character, personality. Empathy, means to consider the patient's welfare and to be kind, ability to be objectively aware of and have insight into another's feelings, emotions, and behaviors, and to be aware of the significance and meaning of these to the other person. Facilitate, to make an action or process easier. Improvise, to make, invent, or arrange in an unplanned or spontaneous manner. Integrate, to incorporate into a larger unit, to form or blend into a whole. License, permission by competent authority to engage in a profession, permission to act. Licensure, refers to the granting of licenses to practice a profession. Litigious, prone to engage in lawsuits. Practicum, transitional stage providing opportunity to apply theory learned in the classroom to a healthcare setting through practical, hands-on experience. Professionalism, the qualities that characterize or distinguish a professional person who conforms to the technical and ethical standards of the profession. Proprietary, privately owned and managed facility, a profit-making organization. Registered medical assistant, credential awarded for successfully passing the AMT examination. Scope of practice, the range of clinical procedures and activities that are allowed by law for a profession. Acupuncture, treatment to relieve pain and disease by puncturing the skin with thin needles at specific points. Fringe benefits, benefit above and beyond salary to which an employee may be entitled. Examples include health and life insurance, paid vacation, sick days, personal days, and tuition reimbursement for courses related to employment. Examples of fringe benefits: health and life insurance, paid vacation, sick days, personal days, and tuition reimbursement for courses related to employment. Health maintenance organization, type of managed care operation that is typically set up as a for-profit corporation with salaried employees. HMOs with walls offer a range of medical services under one roof. HMOs without walls typically contract with providers in T community to provide patient service for an agreed-upon fee. Homeopathy, a healing modality that uses diluted doses of certain substances to create an energy imprint in the body to bring about a cure. Independent Physician Association, independent network of physicians in private practice who contract with the association to treat patients for an agreed-upon fee. Integrative medicine, bringing together of two or more treatment modalities so they function as a harmonious whole, as seen in alternative forms of healthcare. Managed care operation, any healthcare setting or delivery system that is designed to reduce the cost of care while still providing access to care. Preferred provider organization, organization of providers who network together to offer discounts to purchasers of healthcare insurance. Allopathic, method of treating disease with remedies that produce effects different from those caused by the disease itself. Most traditional practitioners today are considered allopathic practitioners. Asepsis, protecting against infection caused by pathogenic microorganisms. Bubonic plaque, infectious disease with a high fatality rate transmitted to humans from infected rats and ground squirrels by the bite of the rat flea. Malaria. Acute infectious disease caused by the presence of protozoan parasites within the red blood cells usually comes from the bite of a female mosquito. Moxibustion. Ancient Chinese method of treatment that uses a powdered plant substance on the skin to raise a blister. Opiates.